we are going to try and stay very tightly to our schedule. We have Melanie McConnell from BC Children's Hospital. She'll be speaking on anxiety. Then David Warling, who's in private practice as a psychologist, who will be speaking on OCD. And finally, Dr. Anthony Bailey from UBC speaking on depression. We'll then have Georgina Robinson and David Batstone give us their insights. Both of them, Georgina is the head of the Provincial Outreach Program for Autism and Related Disorders, and David Batstone is a psychologist who has extensive experience in diagnosing children with autism and works around the province. We're trying to leave at least 20 minutes for question and answers. And I just wanted to recap briefly what we dealt with in our last webinar, which was we focused on raising awareness of the dramatic increase in the numbers of children being diagnosed with autism over the last decade. That's in British Columbia, but also across Canada and around the world. What is also becoming clearer and clearer from the research is that there is significantly higher than average incidence of mental health conditions for those with autism spectrum disorder, both children and adults. And we also had a discussion about how behavior analysts provide information on the behavior of children with autism that can be helpful to mental health clinicians, but they are not mental health clinicians. And we just wanted also to be clear that autism funding is not meant to fund mental health services for children with autism, and that they are eligible for services from the children and youth with mental health teams. We would like to acknowledge the tremendous support that ACT has had in this initiative. We've had funding from the Ministry of Children and Family Development. We've had a very effective partnership with UBC's Division of Continuing Professional Development that has led this process, which has included 3 focus groups and a survey, which I urge you all to fill in. You'll find the link at the end of your handout. We also appreciate Dr. Anthony Bailey's role in guiding the content, along with the Expert Advisory Committee, who's fully engaged in developing the framework and the content for this project. Here's the membership of the committee, and if you go to our website, you'll find out more about them. All the letters will be there. The learning objectives I'm not going to read out, but this is what we'll be covering today. Please keep in mind, if your question isn't addressed in this session, they'll still inform the content and the development of the online modules. So these 2 webinars are just the first steps. We recognize that this is a very complex area and that we can't do justice to it in 2 brief webinars. So this is the beginning of a process. So your questions will be very useful to us to inform as we develop the modules. All questions will be edited and anonymized for recording purposes, and if you don't want to be identified, please don't use your name. Here are our speaker disclosures, and now I'm going to turn over the microphone to Melanie McConnell, who has lots of letters, and she's a clinical instructor at the Department of Psychiatry at UBC and does a lot of very important work in the province for helping families and their children with significant anxiety. Melanie.